Neil Dunn, who again has practiced in the healthcare field and who has seen this with his patients. And I want to yield to him what time he may consume.
Madam Speaker, I want to thank Representative Carter, who is a colleague, a friend, and a neighbor, and who also has genuine expertise in this subject. The administration recently published 2 rules which tackle the issues faced by both our Medicare beneficiaries and the pharmacies that serve them. One rule in particular, the Modernizing Part D Medicare Advantage to Lower Drug Prices and Reduce Out-of-Expenses rule, addresses pharmacy direct and indirect remuneration. Fee reform by instituting that DIR will be negotiated at the point of sale instead of the underhanded and retroactive fashion by which the plans and PBMs currently operate. Currently, pharmacies can face these clawback fees after they have already filled and sold a prescription for Medicare Part D and Medicare Advantage. DRR fees have become a catch-all category for pharmacy benefit managers to collect more overhead after a prescription is sold. Pharmacies are often unaware of what they will owe, and the standards for these fees can actually be impossible to meet. As a result, many independent pharmacies in my district are forced to provide the drugs at below cost. Imagine for just a moment, DIR fees are causing pharmacies to operate in the red, all while they're providing life-saving medication to America's seniors. DIR fees have also led to drastic increases in out-of-pocket costs for our patients, which in turn forces seniors into the donut hole of Medicare Part D even sooner. To protect seniors and pharmacists in my district, and as a medical professional, I urge CMS to finalize the language included in the rule which reflects the negotiated price at the point of sale. I thank my colleague and I yield back.
I thank Dr. Dunn for his keen insight on this very important subject and thank him for his comments. Madam Speaker, just a couple other comments about PBMs. Now, as I mentioned earlier, if you look at their website, if you look at what their mission statement is, it's to say that they are there to lower drug cost. Well, that's not working out very well. Now, let me say this. I'm not opposed to anybody making money. I get it. That's capitalism, and that's fine. But tell me, 3 PBMs control 80% of the market. 80% of the market. 3 companies control that, 3 PBMs. The largest PBM, and understand this, the largest PBM in 2016 had gross revenues that exceeded that of Ford Motor Company, of Pfizer Pharmaceutical, and McDonald's added together. Now, again, I'm not opposed to anybody making money, but tell me how a company can make more than Pfizer Pharmaceuticals, McDonald's, and Ford Motor Company combined. And to make matters even worse, those companies are worldwide. This PBM is just domestic. They're just here in America. And again, I'm not opposed to anybody making money, but tell me the value they're bringing to the system. They're not bringing any value to the system. That's why I am in support of what CMS is proposing, of doing away with the DIR fees, of making sure that the rebates, the discounts, if you will, are given at the point of sale, increasing transparency. Madam Speaker, the next speaker is a good friend, a member of the Georgia delegation, Congressman Rick Allen from Augusta. Rick is a businessman, very successful businessman. He understands the challenges in business, and certainly healthcare costs, I'm sure, were challenges for him. At this time, I'd like to recognize him and allow him what time he may consume.
Thank you, Congressman Carter, for yielding the time and for your efforts here this evening to shine a light on an issue that we all know is affecting far too many Americans. You know, it's a shame to keep doing things and they don't work. So something has to be done. Madam Speaker, the rising cost of prescription drugs is causing significant financial burdens for millions of Americans, patients, seniors, and our businesses. Too often, Americans have to choose between much-needed prescriptions and household expenses. However, President Trump made it clear to the American people during his State of the Union address that lowering the cost of prescription drugs was one of his top priorities. And as we've seen throughout his presidency, promises made are promises kept. Earlier this year, the Trump administration issued a proposal that would create incentives to lower list prices and reduce out-of-pocket spending on prescription drugs, potentially becoming the most sweeping change to how American drugs are priced, a much-needed change. By delivering discounts directly to patients at the pharmacy counter and bringing long overdue transparency to a broken system, we are putting patients and seniors first, and that's just how it should be. It's high time to end these kickbacks to pharmacy middlemen, referred to as these PBMs, in this process of dealing with these DIRs, which are putting many of those in the pharmaceutical business in my district out of business. I'd like to thank the administration, Congressman Carter, and my fellow colleagues here this evening for their commitment to righting this ship and reducing drug prices for all Americans, and I yield back.
I thank the gentleman for his comments and certainly appreciate his leadership here in the House. Madam Chair, as you heard earlier from one of our speakers, CMS estimates that this change alone, that doing away with the DIR fees, that putting the discounts, the rebates, if you will, at the point of sale, that they will benefit the consumer, benefit the patient, and could change and could save, I should say, patients over $7.1 to $9.2 billion. Now, let me tell you, that's significant. That's significant for those senior citizens that I was talking about earlier who are trying to make a decision between buying medicine and buying groceries. That's significant to that mother who's trying to buy the medication for her child. Those savings will help. Transparency will help. The savings are going to go much further than just this estimated $7 to $9 billion. Because as we get better transparency, we'll get lower drug prices. I'm convinced of that. My next speaker, Madam Speaker, is a gentleman who certainly understands this issue and has worked closely on it. He's been a champion on this issue. Representative Austin Scott from Georgia has gone to great lengths to study this issue. He's met with small pharmacies in his district. He's discussed with them the problem, and he understands it. And we're very, very fortunate to have him and his input. And at this time, I want to yield what time he shall consume.
Thank you, Madam Speaker. I want to thank my colleague, Representative Carter, for his work on this. He is was a small pharmacy owner before he got here, and prior to my arrival in Congress, I was actually an insurance broker for many years, a health insurance broker. And it always amazed me as pharmacy benefit managers tried to explain their business model that they actually couldn't explain their business model. And so I rise today in support of our local pharmacies and the unique role that they play in serving patients. I stand here today to commend the Center for Medicare and Medicaid Services and the recently proposed rule aimed at addressing direct and indirect remuneration, DIR fees, and drug rebates. Rebates that don't go to the consumer, but rebates that go to multi-billion-dollar corporations. I frequently make stops at local pharmacies when I'm back at my home in Georgia, and I appreciate the services that they provide their constituents. I'm from a small town, and local pharmacists are a fixture in the community, and they're the first line of defense in preventing and treating a customer's needs. They've known most of their customers in their community for many years, and I would give you one brief example.